Hi, everybody. I'm Dr. Kyle Swanson from the Foot and Ankle Center, along with Dr. Beth Reidinger this evening. We'd like to thank you for joining us tonight. We'd also like to thank KSB Community Wellness and Aaron Fox for putting this event on. We'd like to talk tonight about common foot injuries when walking and running. So without further ado, I'm going to turn it over to Dr. Reidinger to begin.
Hi everyone, so tonight we're going to cover some common foot injuries. We're going to talk about the location of pain of these foot injuries or issues, common symptoms, treatment options for them, and then how to prevent them as well. So this is a slide Dr. Swanson has covered previously, which is pretty interesting. So the average stride length of an adult is about 2.5 feet. It takes about 2,000 steps per mile for each person, and then the average person takes about 3,000 to 4,000 steps per day. And when we're running, there can be upwards of 2 to 4 times our body weight on our feet, which can be quite the overload for our feet, and which is why we have a lot of these problems. So one of our first common problems that we see pretty much on a daily basis in our clinic is plantar fasciitis, which can cause pain after rest and with long periods of time on your feet. Usually pain is located at the bottom of your heel, but it can also prevent in the middle of your arch. Another common heel pain is Achilles tendonitis, and this is on the back of your heel. It can be determined to be insertional or non-insertional depending on where the location of the pain is. So if the pain's on the direct back of the heel, that's called insertional, where the tendon attaches to the back of your heel bone. And if it's above the back of your heel, that's non-insertional, kind of in the middle of that tendon. So another deformity called equinus deformity, it comes from the word equine, which is a horse's hoof. It's caused by your Achilles tendon being too tight. This can also cause the plantar fasciitis. It can cause Achilles tendonitis. It can cause metatarsalgia, which we'll talk about in a few moments here, as well as flat foot, neuromas, and increased pressure on the front of your foot as well. So pain from this equinus deformity or the plantar fasciitis. This can cause pain in your first steps in the morning, after activity, and then sometimes the pain is so severe that patients are unable to bear weight. And with compensation from this pain, you can also have knee pain or hip pain resulting from that. Bear with us, we're having some technical difficulties. There we go. Okay, so some treatment options for these heel pain problems. The first and foremost thing is stretching. It's pretty much the most important thing you can do. We recommend stretching 3 to 5 times per day. Dr. Swanson will actually talk about that in a couple moments here. You can also treat with anti-inflammatories such as ibuprofen, physical therapy, heel lifts in your shoes, orthotics or inserts in your shoes, as well as surgery should any of those conservative treatment options fail as a kind of a last option there. Sorry, everyone, we're having some difficulties moving forward with our lecture here. There we go.
Okay. All right, so now we're going to talk about a term and a condition called metatarsalgia. And this is when patients have pain under the ball of the foot. You may actually develop a callus in this location as well, causing the pain to be even more increased. When we perform range of motion or move the toes are typically not painful. This condition is different from another condition called capsulitis, where that is inflammation of that actual toe joint, which is painful. So that can help us to determine and make the correct diagnoses. Another condition is a plantar plate injury. The plantar plate is a ligament that attaches across the base of our toes. And so pain will be elicited or can be present under the base of one of our toes. Most commonly, it's located at the second toe. There's also pain with end range of motion of this toe. And as you can see in the picture, that second toe is deviated or positioned more closely to the great toe, secondary to that injury to the plantar plate. So some treatment options include RICE therapy, which is rest, ice, compression, and elevation. NSAIDs, or utilizing ibuprofen, Advil, or Aleve. There are padding and strapping techniques that we can use as well, as you can see in that middle picture. Orthotics, we can actually make modifications to these as well to help aid in relief. Corticosteroid injections, and if all conservative treatment fails, surgical treatment may be warranted. Some of the prevention, and what can we do to help prevent these conditions? Well, as Dr. Reidinger mentioned, stretching is going to be one of the most important things. We typically recommend stretching 3 to 5 times a day before and after activity, and even before you get out of bed in the morning can be helpful. The main thing is we want to really increase that flexibility in the back of our legs, which will help prevent some of those conditions we've talked about. A good supportive pair of shoes is extremely important as well. Sometimes we utilize inserts and orthotics, which can help as well. This helps realign the foot and ankle and helps reduce that overall fatigue. And then RICE therapy, as we just mentioned. So in conclusion, there are many causes of foot injuries, as we covered. The location of the pain, the symptoms that the patients feel, and our exam help to decipher and make the correct diagnoses to help guide our treatment plans. Our treatments do consist of conservative treatments, and if those are exhausted, we may need surgical treatment to help as well. And then those preventative measures are going to be very important to help keep us on our feet. So I'd like to thank everybody for joining us tonight. I'd also like to take a moment to mention that Dr. Nathan Maurin is going to be joining our team here in July. We're extremely excited to have him, and he will be seeing patients here very soon. So I hope everybody has a fun and safe summer, and we'll talk to you soon. Thank you. Bye.